Hi, I'm Ben Higgins, Vice President of Operations at Friendship. First of all, I'd like to thank you for your participation in our Family and Friends survey that we sent out recently. Your insight and comments were very much appreciated. I'd also like to follow up with you on 4 questions that resonated with each of you, and I'd like to provide you some answers that you might find helpful. The precautions that we're currently using to screen our team members is that we're using this COVID-19 screening form upon entry to the building. This form has been revised a number of times based off of recommendations and guidance from the CDC and the Virginia Department of Health. As it's currently constructed, we're asking people to wash their hands, and then we're asking them about their symptoms or have they taken any medications to prevent those symptoms. We're also asking if they or someone they know is being tested or has come in close contact with somebody that is COVID positive or COVID suspected. These questions go into a bank where we're able to track that individual so that we can know if there was an outbreak, where this individual may have also worked, or we are able to know if this person has have a loved one that's being tested, and so then we can follow them as well, so we can make sure that they're being safely quarantined prior to entry into the building. Our current resident staff mask policy is that all staff must be wearing a mask while they're in the building. It's not totally unlike the governor's order based off of last Friday's recommendations. All of our staff are wearing a mask while they're in the buildings and around our residents. Our medical staff, so folks that are direct care staff workers working directly with our residents, are wearing medical masks. They are not to be wearing cloth masks. All other employees are still allowed to wear cloth masks. And we're keeping this precaution in place at this time so that we can be mindful of our supply usage. And our residents are wearing cloth masks that have been donated to our facility and to our organization by many folks just like you who have sacrificed their time to make masks. And we're asking our residents to wear those masks when they're out and about throughout the facility, and we're asking them to also keep in mind social distancing protocols. We do have access to tests. We have some tests that are on supply here, and if we need to, we are testing residents and staff and sending those tests out to Quest, our laboratory service. We do not have enough tests, however, right now to do mass testing of all residents and all staff like you may have been seeing in the news. This is something that we're working closely with the Virginia Department of Health on because we'd like to do these point prevalence studies to determine if we can do 100% testing of all of our staff and residents. This is something the Virginia Department of Health is working hard on, and they're trying to bring that to our health district. We've currently not gotten that done, but we are still working closely with the Virginia Department of Health in order to do that here in the near future. What visitation will look like in the future is a little bit of a difficult question for us to answer at this time. What we do know is that for right now, our visitor policy will remain in effect. That means that only essential healthcare employees are allowed into the building. We are watching guidance that's coming from CMS and from the Virginia Department of Health about what Phase 2, Phase 3 may look like for us. But at this time, we have no changes planned to our visitor policy until we hear clear-cut guidance from Virginia Department of Health that this is something that they are okay with and would recommend. We will still encourage you to use our GoToMeeting applications. That's been a nice way for families to stay in touch, but we know that doesn't replace the real thing. And as soon as that we can get you into the building to see your loved ones, we want that, we know you want that, and as soon as we can do that safely, we'll be able to do that. In closing, I'd like to give you one more piece of information that may give you some peace of mind. We've been communicating regularly with the Virginia Department of Health and have gotten numerous kudos on our tracking and screening mechanisms that are protecting our residents. That's meant a lot to our team because we've worked very hard on it. And I want to thank you for your support for all of these measures. I know it's not been easy for you guys. I know it's not been easy for us, but we've all worked together to try to do the best thing that we can do for our residents, which is keep them safe. And so I thought I would share that information because it meant a lot to our team to be recognized for the hard work that we've done. And it means a lot to hear from you guys that we did on this survey, that you appreciate what we're doing for your loved ones, and we'll continue to do that. And we want to thank you for your support.